Good morning, everybody. Yesterday we received the exciting news that the FDA approved the Allergan Style 410 highly cohesive silicone breast implants. We're very excited about this development. I've used the implants for 7 years as part of the study, and we've had some really fantastic results for many of our patients. We're already getting a lot of phone calls, so we thought we'd make a short video about what these implants are and the advantages that they have for certain patients. So as I said, the implants are called highly cohesive. And what that means, and some people also use the term gummy bear to describe them, but for the sake of simplicity, let's just call them highly cohesive silicone-filled implants. Highly cohesive means that there's a little bit more cross-linking between the silicone strands in the Style 410 implant compared to a silicone nitrile gel-filled implant. And because of its higher cohesion, it gives the implant some characteristics that are very favorable for some patients. So let's take a look at the two different types of implants. In my right hand, I have a silicone Allergan nitrile gel-filled implant. You can see that this is the round implant that's filled with gel, and when I move the implant around, you can see that the gel is flowing within the implant. You can also see that it has a round shape and that there's some rippling on the surface of the implant. In my left hand, I am holding the newly approved Allergan Style 410 implant. You can see it has a teardrop shape. It has less volume at the top compared to the bottom. And when I tip this implant upside down, the gel does not flow. It maintains its shape. This is because of the higher level of cohesion, and there's also less rippling. So when this implant is placed in the body, it's placed in this position, and it gives a very smooth transition between the chest wall and the beginning of the implant, and there's more fullness in the lower half of the breast. I just want to show you in the catalog that the implant comes in many different heights. So there's a low height, a medium height, and a full height, and then there are more projections. So how much it flares at the bottom increases as you move from left to right, and then within each style there are many different volumes. So there's a high level of customization that's achievable with these implants. Now let's go back to looking at the implant. Because it maintains a shape, it actually also produces a shape. So for this reason, because of the characteristics of this implant, it's very valuable to use in a patient who has a quote-unquote shape issue. So patients who benefit from this type of implant are people who have congenital problems such as tuberous breast, where they have a lack of breast tissue in the lower half of the breast, people who have shape distortions from previous breast surgery or capsular contracture, people who have serious breast asymmetries with varying shapes between the two breasts, and of course patients who have no breast shape because they've had a mastectomy for the treatment of breast cancer. For patients who have a pleasing breast shape but just desire enhancement in terms of the size, you could put in a shaped implant or a round implant and they would both look terrific. But even in that situation, some patients may select the Allergan highly cohesive silicone implant because it has some additional favorable characteristics. Compared to a gel implant, it has a lower leak rate, a lower capsular contracture rate, and probably a less visible rippling compared to a gel-filled implant. Patients who will not like this implant are those that desire an exaggerated fullness in the upper half of the breast, what we call the upper pole. The shaped implant will give you a very straight, natural-looking upper pole, so if you want a more full look in the upper pole, you may choose a round implant that is gel-filled. So I hope this answers some of your questions. You can find more information on our website, drdrpfeiffer.com or breastsurgeryrevisions.com, or feel free to call our office. Thanks and have a great day.